Salmonellosis is a disease caused by the gram-negative bacteria Salmonella. There are many different types of this bacterium. The one most commonly found in horses is Salmonella enterica. The Salmonella bacteria is transmitted through the fecal-oral route, spread through their direct contact or by contamination. With horses, the most likely cause of the infection is through the environment, feed, water supply, or other horses shedding bacteria. Spread of bacterium can occur by wild animals like birds, a common carrier of Salmonella, defecating in the pasture in which the horse grazes in. Other causes could be transportation, change in feed, treatment with broad-spectrum antibiotics, or a history of surgery. Signs and symptoms can vary in horses. Horses can be asymptomatic, a carrier having no symptoms but has the ability to shed and transmit the bacteria to others, especially when stressed. They can have a mild form with symptoms such as fever, loss of appetite, depression, anorexia, and soft, but not watery, feces. The severest form symptoms include rapid onset of severe depression, neutropenia, anorexia, frequent abdominal pain and fever, 6 to 12 hours later followed by diarrhea. The horse's feces will be foul smelling, watery, green to black in color, and sometimes even bloody. In some cases, Salmonella can be systemic, causing severe colic, colon inflammation, septicemia, bone and joint infections, and ultimately lead to shock and die, or I like to say colic and die. Diagnostics. Definite diagnosis is made using a fecal culture. In regard to performing the fecal culture, multiple daily sampling of the feces is recommended as shedding can be intermittent and may not show up in some of the samples. Rectal mucosa can also be tested, but fecal sampling is oftentimes easier. A horse with suspected or confirmed salmonellosis must be isolated to prevent the spread. Treatment consists mostly of symptom management and supportive care. Antibiotics are rarely used. It is key to maintain hydration and electrolyte prevent imbalance, which can be done with IV fluids. NSAIDs can help counteract the pain, along with activated charcoal or biosponge to help protect the GI gut and bind enzymes. In some cases, polymyxin B can be given in low dose to also bind endotoxins. Symptoms can resolve after 7 to 10 days of aggressive supportive care. The easiest way to combat Salmonella is to not get it to begin with. The best thing done by avoiding possible stressors on the horse, isolating new arrivals, and thoroughly cleaning bedding, trailers, and stalls regularly. No matter how cool the name is, Salmonella isn't funny. I'm sorry. However, there are some interesting facts regarding it. For instance, horses can shed the bacteria for weeks, even months. It is also one of the most frequent causes of infective diarrhea in horses, and was one of the most frequent causes of foodborne illness in humans. Over 1.2 million cases occur each year, and around 450 deaths. It may sound like a crazy lie that little bacterium can do all this, but with there being over 2,300 serotypes or subspecies of Salmonella, it most certainly is not, and it is unfortunate truth.